Okay, the Fraser Coast Community Health. So how are we going? Community health is not a race that anyone wants to win in numbers, yet sadly Fraser Coast is leading the way with teenage pregnancy. While the national average with that is 12.8 per 1,000, the Fraser Coast is almost 4 times that at 46.4. Obesity rates, the Queensland percentage is 59.2% and Wide Bay 68.4%, with Fraser Coast sitting at 68.1%. Type 2 diabetes is weighing in at 4.9 people per 100. Heart, stroke and vascular conditions has state statistics at 5.79 per 100 people, and the Fraser Coast is sitting at 7.2. Mental and behavioural conditions state statistics are 9.1 per 100 people, with Fraser Coast sitting at 19.3. And state statistics for infant mortality in babies of less than 1 year is 3.6 per 100, and Fraser Coast is almost twice that at 6.1. So each point being a whole topic on their own, although the PHN reports suggest that there is an improvement in some areas, but much, much more needs to be done. The National Rural Health Alliance's January 2020 fact sheets report that in aggregate, people who live in rural areas have shorter lives and higher levels of illness and disease risk factors, more so than those in major cities. This can be explained in part because they have poorer access to goods and services and educational and employment opportunities, as well as lower levels of income. Australia-wide evidence shows that the health of rural people is poorer than that of their city counterparts. Accessing primary health, dental care, allied health and specialist services is more difficult and in many regions requires greater time and expense for travel and accommodation. The health of Indigenous people in rural and remote areas is significantly worse. The viability of many rural hospitals is uncertain, and there has been serious loss of capacity for maternity services and other procedural care in rural areas. Infrastructure in rural and remote areas for health services and health-related activity is limited and being further eroded by a lack of ongoing investment. Shortages of health professionals, including doctors, allied health professionals, pharmacists and dentists, becoming more pronounced with remoteness, and it is difficult to attract and retain those health professionals in rural and remote areas, particularly those who study and train in our more metropolitan areas. Now, it doesn't sound inspiring, and quite frankly, the statistics are depressing. However, there is change happening. The Fraser Coast community is coming together and developing programs to either ease the climb of the numbers or to support those after the fact, such as Hervey Bay Hospital's Cuddle cot initiative. Now, the Cuddle cots are special cold units that are created in a basket in a box type environment, which helps preserve the body so that parents can place their stillborn child in that box and take them home and spend time with them and go through that grieving process for as long as they need. It's important that it does support that grieving process. Another example of community is Maryborough State High School's vision to move forward and develop a new student enrichment precinct, enabling all students the opportunity of an education with breakout zones for mental health care. Now, this project is on target to be completed by the 14th of January 2021. Maryborough State High School has also worked towards addressing the medical professional retention rate by negotiating and securing education agreements with Central Queensland University. CQU will be the RTO in partnership with the school to enable health career focused curriculum that comes into effect next year, 2021. Students in Year 11 may undertake Certificate 2 and Certificate 3 health services, moving forward to a diploma in medical services in their Year 12 years. The educational agreement leads then direct into a Bachelor of Medical Science at CQU. By the time the Bundaberg Level 5 hospital is complete in 2025, these students will move forward into a post-grad in medicine, all while never leaving this region. The program will save students thousands of dollars by enabling them to complete their degrees 2 years earlier, and currently there are 26 students ready to start next year. The precedence has now been set to encourage and advocate for other educational institutions to commence discussions with universities to address skill shortages and to enhance educational and employment opportunities in the region, which sets a pathway to improve the community health statistics. The initiative also fits across a number of other themes. The social plan will hopefully help retain it and will also help keep younger people in the region. So there's still a long way to go, but the future is looking bright. We are in this together, building a Fraser Coast we can all be proud of, and a Fraser Coast that others want to be part of.